You've tuned into Out of the Voice Box, where candid conversations bring great minds together from across the nation.
Join us for access to cutting-edge voice-related information you won't find in a textbook. Yet.
We are your hosts, Sarah Charney
and Nathaniel Sundholm.
The opinions and viewpoints on this program are those of the featured individuals, not their respective institutions. This program is not a substitution for medical care.
On today's episode, we explore the challenges for unconventional breathers. Namely, during these pandemic times, many neck breathers have expressed confusion and concern regarding personal protective equipment. If some of these terms are unfamiliar or uncomfortable, don't worry, we'll catch you up in no time because we've called in backup.
Jenn Starkweather, a certified speech-language pathologist, is InHealth Technologies' East Coast clinical specialist. In her current role, she provides clinical insight and boundless training opportunities for care of the laryngectomy. It's always a pleasure talking with someone who's both a wealth of information and an all-around brilliant, enjoyable human being. We are so excited to have her. Thank you for joining us today, Jenn.
Thank you so much for having me. I'm so excited to be here.
So can you give us an elevator speech of why you felt it was important to make this change and give access to so many people in this way?
What this role has allowed me to do is work with not only patients through their clinicians, but work with their clinicians and be able to impact clinical practice and impact so many more patients just by the work that I get to do with their clinicians. And so I feel so fortunate to still have all of my colleagues and just kind of work with them in a little bit of a different manner. And so it's really been a wonderful opportunity for me. So I think I've been with InHealth now I think I just hit my 4-year anniversary, actually. Yeah, thank you. But it's really been a fantastic opportunity. And it's just been really wonderful to really dig in and really expand my practice in that sense.
So in essence, you are everyone's backup now, right? So you're not just the backup of your team at the Voice Center. You are now the backup for the East Coast. So we are so thankful for you. I threw out a couple of terms in the introduction today, and we were hoping that you could add and clarify and just give a brief description of who might be considered to be a neck breather. An audience, I am doing finger quotations here. And is this an okay term for us to be using?
Yes, the term neck breather is absolutely an okay term to use. Now, I may not use it in like an endearing sense, like, hey, neck breather, how are you?
Okay,
but really more in the medically descriptive sense. So a neck breather is someone who predominantly breathes in and out of a surgically created hole in their neck called a stoma. And neck breathers oftentimes have difficulty breathing in and out of their mouth, or they're not able to breathe in and out of their mouth and nose at all. And therefore, doctors have to bypass the nose and the mouth and allow the patient to get air to their lungs via their neck, hence the term neck breather.
Gotcha. So it's like a new airway entry point.
Exactly.
For many medical providers, clinicians, patients themselves, there can be a lot of confusion regarding the difference between someone who is a laryngectomy versus someone who has a trach in place. So can you give us your best elevator description of the differences so we can better explain this to our patients and other clinicians can better understand too?
Sure. So let me start by saying I can absolutely understand why this might be confusing because, visually these patients, somebody that has a trach tube and a laryngectomy, they appear very physically similar externally. So there's a stoma, and then there's some sort of tube maintaining the patency of that stoma or of the airway. And it's not actually until we understand that patient's internal anatomy that we realize there can be some pretty large differences in these patients who are indeed neck breathers. And all of these differences actually can make a huge impact on not only treatment, but also on safety. And so there are two key differences we have to understand in our neck breathers. Neck breathers can either have a larynx, or at least part of a larynx, or they may not have a larynx at all. And so our patients without a larynx are called total laryngectomees. And this just means that the entire larynx has been removed and the trachea is turned outwards to create a stoma. The upper and the lower airways are no longer connected and they cannot be reconnected. So the patient cannot breathe in and out of their nose and mouth. And a laryngectomy stoma is permanent. It can never close. And I cannot stress that enough.
And it should never close.
It should never close.
Should never close. We want to keep those stomas nice and open.
Nice and open.
That's their only airway.
Absolutely. So just for those in the back, laryngectomy stoma should never close, ever.
Absolutely.
So the other group I want to highlight in our neck breather population is the group that do have a larynx, or at least part of their larynx. And in this group, the nose and the mouth are still connected to the lungs and the lower airway, but there's some issue that's making breathing difficult for the patient. So the nose and the mouth have to be bypassed to allow air to get to the lower airway, and therefore a tracheostomy is completed and to allow that patient to breathe through their neck. So sometimes, depending on that situation, this type of stoma could potentially be reversed and allowed to heal, but not necessarily on everybody. Again, that really just kind of depends on the medical situation. But, kind of like we talked about before, understanding these differences is critical. These have huge safety implications for our patients.
So I have a couple of follow-up questions. One, let's talk CPR, baby. So
Absolutely.
for someone who is a neck breather, is CPR and rescue breathing something that changes?
It is indeed. That is a great question. So in a neck breather patient, CPR must go mouth to stoma, not mouth to mouth like we traditionally know. And that's really important. If you do mouth to mouth on somebody that is a neck breather, you're just going to make them really gassy, right? That air is not going to get to their lungs. Therefore, in a neck breather, again, it must go mouth to stoma in order to really aerate and perfuse the lungs.
So, regarding emergencies, is there something that patients can have on them, perhaps wear, or something that can make other medical providers or the people around them more aware of those differences?
That is a great question, and indeed there is. I know that there are orange bracelets. I don't know if you remember the yellow Livestrong bracelets, but there are orange bracelets that say neck breather on them. They are available in many different sources, from many different sources, but we do recommend that our patients wear those all the time. There can also be medic alert bracelets where medical information is provided via some of their applications. There are also kind of a dog tag style necklace that patients can wear. There are also window clings that you can put on a car. God forbid somebody was ever in a car accident or something like that, or needed emergency medical care, where an EMT would come up to their car to provide care. So there are many different ways that we are able to identify patients who are neck breathers, and our patients and their families should be as active in that dissemination of information as they can possibly be.
So what I hear you saying is that this level of identity, first and foremost, is out of safety. Someone who is an active neck breather is owning this fact in order to ensure that they're safe, given that they need some kind of medical treatment. And in that, a lot of people have chosen to use this as a branding for their new lifestyle of being a hashtag neck breather. Our world is changing. We are all thinking a lot more medically these days. A lot of people who stay at home have become self-proclaimed medical professionals. I'm so glad that I work with some of the best medical professionals that help me guide my thinking with evidence-based practice.
Okay.
Given that we are in new times, in a pandemic that we have never seen before, a lot of my patients, especially in clinics devoted to airway, so folks that are neck breathers, they're really worried about how they can actively take appropriate precautions against the coronavirus so that they themselves are being safe, and that if they, for some reason, did contract the virus, that they can adequately protect those around them, given that everyone is wearing a face mask, but they are breathing out of their neck. So, Jenn, what do we do?
Let me just start by saying that there are people who have dedicated their entire careers to science. And I think honoring that is very important. And so, as people are searching for information regarding the novel COVID-19 virus, I highly recommend seeking out some of the resources that they have made available. And so, with that, there are some excellent resources on the American Academy of Otolaryngology website. They have tons of open access journals when it comes to COVID-19 and what to do in terms of practice patterns and how to keep yourself safe. I know ASHA, the American Speech Language Hearing Association, has also made several resources available. And of course, we have the CDC. And so, with that, what do we do? I think it's, COVID-19 is very tough. We are learning something new about this virus almost on a daily basis. And so what we currently know, or what we currently think we know, is that the spread of the virus is through respiratory droplets. And what we also very much know is that people with underlying medical conditions are particularly vulnerable to this virus. So with that, I think the first precaution is, if you don't have to go out, don't. That's the short of it. Now, I want to give grace to those who sometimes we do have to go out. The CDC does, and several other organizations do recommend wearing a mask to cover your nose and mouth. And with that, I also think it's very reasonable to cover the stoma as well. We have to remember that the mask isn't just protecting us from inhaling potentially infected respiratory droplets, but it's also keeping us from spreading that virus if we have unknowingly contracted the COVID-19 virus. That's a lot of information. Where should we pick up from there?
I think that it's true. We don't know a lot of these things, and information is constantly changing. But from the information that we do know, what do you think is the most recent and updated recommendation for how these individuals should be getting tested for the COVID-19 virus? People are asking, is it through the stoma? Is it through the nose? Is it both? Can you tell us a little bit about that?
Yeah, that's a really great question. The short is, I don't know, but I can tell you, what I've heard. I am fortunate to be in contact with many wonderful high-level clinicians and high-level facilities across the country. And so, Sarah, like you were saying, there are some places that recommend swabbing just the nose and the throat. There are other places that recommend, just swabbing the stoma, and there are places that recommend doing both. I think, if I could go a little meta on it, the way that I look at it is from the standpoint of potential pathways of infection and transmission, right? So if we believe that this virus that people are infected when the virus comes in contact with their mucous membranes, so we have to consider all of those pathways, and that includes the eyes, the nose, the mouth. And because the trachea is lined with mucous membranes and airflow is obviously passing via the stoma, we have to consider the stoma in this as well. So all of that to say, I think not only should we be considering testing all of those potential locations, but I think we should also consider wearing a mask, not only over the nose and the mouth to protect the nose and the mouth, but also over the stoma.
So I have a follow-up question about the mask over the stoma.
Sure.
So I think you really nicely clarified that the purpose of the mask is to protect you from me, as well as to protect me from everyone else. So we know that depending on what type of neck breather the person is, there are different things that everyone uses. So for instance, someone who has a stoma may have an HME in place. Now, do we think that an HME, and if you can explain just briefly what an HME is, do we think that that also acts as some level of filtration similar to a mask, or would you still want to put some type of barrier over that?
Sure, that's a great question. So an HME stands for a heat moisture exchanger. Kind of like we talked about the neck breather concept before, that the nose and the mouth are not the predominant way that a neck breather is breathing, right? That means all of the air that a neck breather is breathing in and out is no longer filtered or heated by the nose and the mouth. And so a heat moisture exchanger is just a little cartridge with a treated foam inside that cartridge that allows the air to be heated and moisturized as a neck breather breathes in. Now, yes, it provides an excellent level of filtration. However, to the best of my knowledge at this point in time, heat moisture exchangers have not been tested against COVID-19, to the best of my knowledge. And so it's really difficult for us to be able to take a step back and say, yes, this filter is going to be able to filter out all of these things, because it hasn't been tested in that environment. So I am the kind of person that at the end of the day, I would rather be overly cautious than not cautious enough. My risk benefit ratio tells me not only should you be wearing an HME, but you should probably also be wearing an additional cover over that, if that's going to provide you that extra level of protection. And especially, again, like we talked about, we know that COVID is particularly impactful on patients who are medically fragile. And we know that our patients that have a tracheostomy or have a laryngectomy, breathe through a stoma, tend to be more medically fragile than the general population.
Absolutely. So I imagine the same would then go for a passy-mur device, right? That keeps the air from exiting the new air passageway, but we don't know the extent to which it also protects the world from your droplets, right? So I think what I hear you saying overall is that it's probably better to err on the side of caution and protection of you and others than to trust that, oh, maybe it's good enough, because we all need to be better than good enough.
I agree. And also, I know that the HME and the passy-mur valve, correct me if I'm wrong, Jen, have often been compared to their new nose. Yet we all have to be wearing a mask over our nose, so that could also be something to think about. It's the same thing as putting a mask over your nose. Even though there is some filtration, might not be good enough, just like you said.
So this has been just a fantastic discussion. And, I think we could go on for a lot longer just trying to get to the bottom of all of these questions that we have. Before we put the conclusion on our time together, we just want to know, are there any big questions that you feel like really need to be answered when it comes to care for the laryngectomy during Corona, or care for someone with a neopharynx?
Oh, goodness. I have so many questions. You guys know I'm a questions person.
That's okay. Give me top three.
Oh my goodness. The top three questions that I still want to know in regards to laryngectomy and COVID-19. One, I think that we have been, or at least the clinicians that I've spoken with have been very fortunate that the vast majority of their patients have not contracted COVID-19. Again, working predominantly in the Southeast, this could be very geographical. So my big question is, how have the social behaviors of our laryngectomy patients changed during COVID-19? Are our patients more cautious? What are their family members doing on their behalf? Are they still going to work? Are they staying home? What are our laryngectomy patients and our tracheostomy patients as well, what are they doing to keep themselves safe? Because really, I wonder if we can take a page out of their playbook. That's thing one. Thing two, I know that many facilities at the start of COVID-19 really worked with their patients to try to keep them at home and to try to keep their exposure at a minimum. And sometimes that meant holding off on a TEP change that they might otherwise have, and using plugs, which is great. I'm a big advocate of all these things, right? But I'm really curious, how will that impact our future practice? What does that look like? Have we fostered another level of independence with our patients as a result of our current situation because of necessity? And then I think my third question, kind of as a follow-up to that, and if anybody wants to do a study on that, holler at me. I'm also really curious as to what does that mean from an anatomical standpoint for our patients and their tissue. So if we haven't seen our patients in about 4 to 5 months and we've pushed off, or even if we've not seen them for 4 to 5 weeks outside of their typical time frame that they would get their TEP change, how does that impact their tissue? Is there a negative impact on that? And if there's not, again, how does that impact our future practice? And what does that actually look like? So you made me bullet point them, and now I'm going off and I have like 50 more questions that I want to ask.
Well, keep them.
So many more.
Keep them, and we can always have you back.
Exactly.
For our listeners out there, for those who are in graduate programs, who are young clinicians, who are seasoned clinicians, who aren't even speech language pathologists, there is so much room for scientific growth in our practice. And if you have a question, that question is important and deserves to be answered. And seek out ways every day that you can learn to answer that question in a way that is both repeatable and authentic. And that, I think, is where we're going to close this episode. So thank you so much, Jenn, for joining us. It was an absolute pleasure. You are a joy to have.
Thank you so much for having me. This is so much fun. This is my first podcast, and it's been wonderful.
We are so happy you joined us today, Jenn. And to our listeners, we hope you enjoyed today's episode and catch you again next time.